My mother was a nurse. I came in one day and she was packing books in the basement. And I said, well, what are you doing? And she goes, I'm just getting rid of all my nursing books. And she said, I don't think anybody's going to use them. And that's when we started to have a discussion. And I signed up for nursing school, got my RN, and then went on to get my doctoral degree. I'm Peggy. I've been in practice for about 43 years. I'm a wife, a mother, a grandmother, a great-grandmother, and I live with rheumatoid arthritis. My symptoms started in 1993. It was the day before my daughter's 5th birthday, and I started to get really achy, almost flu-like. I got up in the morning with difficulty moving anything. I went to my PCP, and he said no, there was nothing that we could do. I had gone to multiple doctors. They were unable to give me a diagnosis because the symptoms continued to progress. I never got better from that point. But I continued working and taking care of my children.
And it went into remission. It came back. If I would see her laying on the couch and she wouldn't get up, I knew that she was having slips back into the disease.
I had to put on the brakes and say, I need help. My husband was there every step of the way. I would make a phone call and say, you have to come home. I'm going into crisis. My mother was there a lot. My sister would drive every weekend to help out. As a caregiver, it was a humbling experience to need care. The doctors tested me for multiple things. I was diagnosed with RA in 2010. I found a rheumatologist. She was unwilling to give up on me, and she went to a conference, and she came back and she said, I have something for you, and it's an everyday injection. I knew to help my joints, I had to do something, and that's when I started Kineret. After I started the medication, there was a turnaround in my symptoms. Experiences per individual may vary, but my experience with Kineret has been positive. Kineret allows me to carry on with my activities of daily living. I live life to what I think is the fullest. When I first started Kineret, I noticed some redness around the site of the injection. The injection itself, it's a little bit painful, but there are some methods that you can use to help minimize the pain, such as letting the Kineret warm a little bit before you inject it. You might rub the site, or you can use some ice after the injection. I was supposed to retire, and I thought, well, this is too much time on my hands, and went back to work. I think my illness has taught me that you need to listen. When my patients are describing something to me, I've been there. I've been on the other side.
Peggy is a person who really loves to help people. She's tried to push that same belief in our children and trying to now do it on the next generation, our grandkids.
I have been very humbled by the experiences that I went through, and continue to be humbled with the experiences that I see people go through. If I were to talk to someone who's starting Kineret today, I would tell them to develop goals and try to achieve those goals. I would tell them to stay motivated, that there is life after the diagnosis.
Indications. Kineret Anakinra is a prescription medicine called an interleukin-1 receptor antagonist IL-1RA. Use to RA. Reduce the signs and symptoms and slow the damage of moderate to severe active rheumatoid arthritis RA in people aged 18 years and older when one or more other drugs for RA have not worked. NOMID. Treat people with a form of cryopyrin-associated periodic syndromes CAPS, called neonatal onset multisystem inflammatory disease, NOMID. DIRA. Treat people with deficiency of interleukin-1 receptor antagonist, DIRA. Kineret is not for children with juvenile rheumatoid arthritis. Important safety information. Do not take Kineret if you are allergic to proteins made from bacteria called E. coli. Ask your healthcare provider if you are not sure. Anakinra or any of the ingredients in Kineret. See the end of the patient leaflet for a complete list of ingredients in Kineret. Before starting Kineret, tell your healthcare provider if you have an infection, a history of infections that keep coming back, or other problems that can increase your risk of infections. Are scheduled to receive any vaccines. People using Kineret should not receive live vaccines. Have kidney problems. Are pregnant or plan to become pregnant. It is not known if Kineret will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Kineret passes into your breast milk. You and your healthcare provider should decide if you will use Kineret or breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Kineret and other medicines may affect each other and cause serious side effects. Kineret may cause serious side effects, including serious infections. Kineret may lower your ability to fight infections. Call your healthcare provider right away if you get an infection, have any sign of an infection including a fever or chills, or have any open sores on your body. Due to the risk of infection, you should not receive live vaccines while you use Kineret. Serious allergic reactions. Stop using Kineret. Call your healthcare provider and get emergency help right away if you have any of these symptoms of a serious allergic reaction: swelling of your face, lips, mouth, or tongue, trouble breathing, wheezing, severe itching, skin rash, redness, or swelling outside of the injection site area, dizziness or fainting, fast heartbeat or pounding in your chest, tachycardia or sweating. People with DIRA may have an increased risk of allergic reactions, especially in the first several weeks. Decreased ability of your body to fight infections. Immunosuppression. It is not known if treatment with medicines that cause immunosuppression, like Kineret, affect your risk of getting cancer. Amyloidosis. Kineret may cause a buildup of abnormal proteins called amyloids around the injection site, a hard lump under the skin. Avoid using the same site to inject Kineret by rotating to alternating areas of the body. Your doctor may monitor you for amyloidosis. Low white blood cell count, neutropenia. Kineret may cause you to have a lower number of certain white blood cells, neutrophils. Neutrophils are important in fighting infections. Your doctor should do blood tests to check your white blood cell level before starting and during the first year of treatment with Kineret. The most common side effects of Kineret include injection site skin reactions. The symptoms of injection site skin reactions may include redness, swelling, bruising, itching, and stinging. RA gets worse with treatment if you already have RA. Headache, nausea and vomiting, diarrhea, joint pain, fever, feeling like you have the flu, sore throat or runny nose, sinus infection, pain in your stomach area. Tell your healthcare provider if you have any side effect that bothers you or does not go away. These are not all of the possible side effects of Kineret. For more information, ask your healthcare provider or pharmacist. You can also see the full prescribing information for Kineret, including patient information and instructions for use at https://www.kineretrx.com/pdf/full-prescribing-information-english.pdf. To report suspected side effects, contact SOBI North America at 1-866-773-5274 or FDA at 1-800-FDA-1088.